Joining us for this week's Your Health segment is Dr. Katrina Mark, Assistant Professor of Obstetrics, Gynecology, and Reproductive Sciences at the University of Maryland Medical School and an OB/GYN physician at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thanks for having me.
We want to focus on cervical health. January is Cervical Health Awareness Month. Why is cervical health so important?
Well, cervical cancer is one of the areas in medicine that we've really made the most progress in the past few decades. It is one of the most, if not the most preventable type of cancer. We've decreased the incidence and mortality from cervical cancer over 50% since the invention of the pap smear. And so any time that we can prevent cancer is a huge win. Has the pap smear itself changed? It wasn't always a popular thing. Well, the process of the pap smear is still not terribly popular, but luckily one of the changes in screening recently has been that we don't do yearly pap smears for most women anymore. The process of a woman getting a pap smear hasn't changed much, but the technology of reading pap smears has improved. What's the result of that? The result is that we have more accurate testing. We've also added the addition of HPV testing, which is really the main reason that we've decreased the frequency of pap testing. All right, so that gets into the whole area of HPV, and people may have heard of the vaccine, which we can talk about. Right. How is that connected to cervical cancer? So HPV is the cause of cervical cancer. Cause of all cervical cancer? Yes, so HPV is the human papillomavirus. It's a sexually transmitted virus that is the most common sexually transmitted disease. Over 80% of people that have ever been sexually active have had it at some point. Luckily, most of the time it goes away, but when it doesn't go away, then it can cause cervical cancer. And there are different variations of the virus. Right. There are over 100 strains of HPV. There are the 13 most common type that create or that cause cervical cancer are the ones that we test for when we test HPV. But there are a lot of types that don't cause cervical cancer as well. Do they tend to cause symptoms? Would somebody know if they had this? No, the types that cause cancer don't cause any symptoms at all, which is why it's so prevalent. There's really no treatment for it if you know you have it, unless it's causing problems, precancerous cervical cells, and there's no way to know you have it unless you have an abnormal pap smear. When somebody comes into the office and turns out to have cervical cancer of some advanced degree, what are the symptoms? What causes them to come see you? So luckily, cervical cancer is pretty rare now that we are able to screen for it. So most women come to see me for the screening pap test to prevent cervical cancer. But those women that do have cervical cancer may have bleeding or pain or abnormal discharge that cause them to come and see a doctor. But luckily, most of it we can pick up way before it gets to that point. So how do you think about the introduction of this vaccine? Wasn't that long ago. How big a deal is it? I think it's a huge deal. We don't have very many vaccines that prevent cancer. We don't have very many treatments at all that prevent cancer. So I think that it's really kind of undervalued, and unfortunately hasn't been uptaken as much as we would hope in the medical community. Why do you think that is? When it was introduced, it was not just one shot, it was a series. Right, and it had the reputation as being painful for some reason. Right, it still is. Any vaccine is going to be painful. I don't even like getting flu shots, but I get them every year because I know they're helpful. The series is still 3 shots. They're working on seeing if they can get it down to 2, but for the time being, it's still 3. And it's recommended by the CDC that it be given to children ages 11 to 12 for both males and females. I think that part of the reason that it's not as popular as we would hope is that people think of it as a vaccine against a sexually transmitted disease instead of a vaccine against cancer. And really, I think if people thought of it as a cancer vaccine, they may be more willing to accept it. Let me remind our viewers, if you have a question about cervical health, cervical cancer, the HPV vaccine, give us a call. We'll have the number on the screen, or you can tweet your questions. Twitter address is @MPT News. When the vaccine came out, it was just girls. Right. That changed? Yes, it's girls and boys now, up to the age of 26. It's studied as young as 9, but it's recommended around 11 or 12. The point is to try to get it to people before they're exposed to HPV, so before the onset of sexual activity. And I think that that is where some of the controversy mythology that surrounds the vaccine comes from is because some parents that are recommended you should get this vaccine, it's against a sexually transmitted infection, the response is, well, my kid's only 12, he's not having sex. So I think people get a little bit resistant to it at that point. And it's not that women and men can't get it after the onset of sex or the initial exposure to HPV. It's just the most effective if you get it beforehand.
Are they giving it to anybody over 26?
So insurance usually doesn't cover it over 26. And the idea is above 26, most people at that point have been exposed to some strains of HPV, but it probably still has some benefit to people beyond 26 too. It's just that insurance doesn't cover it then.
What can the vaccine do? What can it not do? I mean, does it get all the strains that you would want it to get? And how effective is it?
It's very effective. The initial vaccine, there was one that covered only the two most common types that cause cancer. Then the next vaccine covered the two most common types that cause cancer and the two most common types that cause genital warts. There's now one that covers 9 different types, which covers about 90% of the HPV that causes cervical cancer. But one of the big misconceptions about the vaccine is that if you get it, then you're covered and you're not going to get cervical cancer, which is not true. Women still need to go through screening tests and have pap tests done, even if they have the vaccine.
Say that again. Why would that be?
Because it doesn't cover every single type that could possibly cause cancer. It covers the most common types, but not every type.
This may be a dumb question, but why do boys need to get the vaccine when they don't have a cervix?
Right, it's not a dumb question at all. It's a great question. So there's many reasons. The first reason, and we promoted a lot, I'm here, of course, to talk about cervical health. The first reason is because most women that get HPV get it from men. And so if we can decrease the rate in men, that will ultimately decrease cervical cancer. But the other reason is because cervical cancer isn't the only type of cancer that's caused by HPV. Head and neck cancers, anal cancer, penile cancer are all associated with HPV as well. So it can actually decrease the rate of cancer in men as well.
Let's grab a phone call. Baltimore City, this is Alma. Thank you for the call. Go ahead.
Hi, I would have a question.
Sure.
My question is that if you have a male who is 18 years old who was not vaccinated, is it possible for that person to get vaccine and it be effective at this age?
Absolutely. I would recommend that anybody get vaccinated at any time, especially under 26. It should be covered by insurance. And we say 11 or 12 to the start because, as I said, we like to give it before the onset of sexual activity. But whether or not an 18-year-old has been sexually active, I would recommend it no matter what. Yes.
Twitter question. Young man wants to know how could he find out if he has HPV, the virus? Is it possible to test for it? And if somebody has it, is there a way, if they're sexually active, to not spread it?
All very good questions. So unfortunately for men, there's no test really for HPV. We test women during their pap smears, but really not until after the age of 30. And the reason we don't test women until after the age of 30 is because we know that a lot of people get it transiently, meaning they have it for a couple of months and then their body gets rid of it like any other virus. So for men, there's no test. The only real way to prevent it is to use condoms during sex, just like other sexually transmitted infections. It's not 100% effective, but it can decrease the transmission significantly.
Call from Montgomery County. This is Adrian. Adrian, thank you for calling. Go ahead.
Hi, I recently had the LEAP procedure, and I was wondering how common that is in American women.
The LEAP procedure is very common in American women. So LEAP stands for Loop Electro-Excision Cautery Procedure. And that is how we treat women that have abnormal pap smears and precancerous cells in their cervix. So we've talked about HPV and pap smears and how they're screening tests for cancer. So the great thing about cervical cancer, although it sounds silly to say something's great about cancer, but it has a detectable precancerous state. So when we do a pap smear, we can find women who are at risk for getting cervical cancer. And the LEAP procedure is how we treat those women and remove the abnormal cells that have been affected by the HPV virus to prevent them from ultimately getting cervical cancer.
So you keep the cervix.
Right, and you just remove the abnormal cells, exactly.
Let's grab another call from Howard County. This is Sue. Sue, thank you for calling. Go ahead. Sue, are you there?
Yes, I'm here.
Okay, what's your question?
My question, is there another test other than a pap smear to detect cervical cancer?
Thank you very much.
The only two tests right now are pap smear and HPV. We do them, as I said, for women over 30, we do them in combination because we know that HPV is what causes cervical cancer. So if a woman doesn't have HPV, we don't anticipate she's going to get cervical cancer anytime soon. The Pap test is testing to see if the HPV has had any effects on the cervix.
Talk about the emotional side of this. If somebody finds out that they have the virus or they have these early indications, precancerous conditions, and even within a relationship,
Right.
What's the impact?
So one of the hard things about HPV and discussing it with women is that it's impossible to know when a woman got HPV. And so frequently when I discuss with a woman the diagnosis of HPV, she immediately jumps to the conclusion that her partner is not being faithful, which is absolutely not true. A woman can get HPV and not have effects of it for 5 or 10 years. So there's no way to really pinpoint when you got it or where it came from, which can sometimes cause stress in relationships, certainly. Also, the concern that it's being passed back and forth. So once a woman is exposed to HPV and we treat it, oftentimes her body produces antibodies to it and then she doesn't continue to get repeat infections from the same partner. But that is one of the big concerns women ask me. If I have it now and I stay with the same partner, aren't I going to continue to get it?
For people who may have missed the beginning of this, the incidence of HPV is unbelievable. Right. You said 80%?
80%
I read somewhere 14 million new cases a year.
Yes.
Cases is the wrong term because people don't know they had it.
Right, exactly. And so that's why it's a bit of an estimate to say 80%. It may even be higher than that. But the good thing about it, although it sounds very scary to say that 80% of people get HPV, not all types of HPVs cause cancer. And even the ones that do, about 90% of people will clear that on their own without ever even knowing they had it.
Wait, how does that work?
It's the same way
in layman's terms. How do your body just gets rid of it?
Gets rid of it.
And even if you had the cancer-causing strain, you don't get cancer.
Yep, that's totally possible. So it's just the way that you can get a cold and then your body's immune system just fights it off within a few days or a week. The same thing happens with the HPV virus. Within 8 months, most people will get rid of it. It's the people that aren't able to get rid of it and for some reason it stays in their body for a longer period of time that it's more likely to cause cancer.
Let's take a call from Prince George's County. This is Shalette. Forgive me if I got the name wrong. Thank you for the call. Go ahead.
Hi.
Hi.
I was just wondering because I was told by my doctor that I do have HPV. She told me the only thing I could do was eat leafy greens and take a Centrum vitamin. And it concerned me because I just heard the young lady say that she had a procedure done. And I didn't really catch the name of the procedure. I wanted to know what procedure did she have done, and how do I get that?
Sure. So the name of the procedure is a LEAP procedure, but not all women that have HPV need a LEAP procedure. So we haven't really talked about the change in screening guidelines of cervical cancer screening that have happened over the past few years, but we've started to space out screening a bit and not screen every year for women who don't have HPV and have normal pap smears. When you have a pap smear and HPV test, the HPV may be positive, which that just means that you've been exposed to the virus. If it hasn't changed your pap smear, and that means it hasn't actually affected your cervix yet. You've just gotten the virus and your body is very likely to clear it. If a woman needs a LEAP procedure, that's because the HPV has affected her cervix and she has precancerous cells on her cervix. So most women that have HPV do not need any procedure. They just need to wait time and their immune system is likely to get rid of it on its own, and then your doctor will check again in a year or so and see if that HPV has resolved on its own.
So the important thing there is follow-up.
Exactly. So cervical cancer screening guidelines have spaced out, and women who don't have HPV and don't have abnormal pap smears can wait 3 to 5 years, but every woman should have individualized counseling with her gynecologist to decide what the right frequency of testing is for her.
That's a good place to leave it. Dr. Katrina Mark with the University of Maryland Medical System, thank you so much.
Thank you.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.